All right, let's go through this case together. What we're looking at is a supine chest radiograph of an infant. A few key details jump out at me. First, there's a nasogastric tube, but the tip is in the distal esophagus and really should be advanced into the stomach for proper placement. Notably, the middle part of the tube deviates to the right as it passes behind the heart, which is an interesting observation. We can also see some splaying of the carina, which, along with the other findings, suggests left atrial enlargement. Given the projection and the age of the patient, this likely indicates generalized cardiomegaly in addition to the left atrial enlargement. There's perihilar haziness bilaterally and increased interstitial markings, especially notable in the right lower zone. While these could be due to an infection, in the context of the other signs, they more likely represent interstitial pulmonary edema. These observations make me consider that we might be dealing with congenital mitral valve disease. I'd recommend discussing this with the referring clinicians, and a follow-up assessment with echocardiography would be crucial to further understand the heart's condition and function. Moving on to the diagnosis, we are seeing signs consistent with a 2-month-old girl who has mitral regurgitation and pulmonary hypertension. These findings are crucial because they point towards congenital heart disease, which includes a spectrum of conditions like tetralogy of Fallot and transposition of the great vessels. It's vital to be familiar with these, as well as with the corrective surgical procedures that might be identifiable on a chest radiograph. So how do we differentiate these conditions? Clinical features such as cyanosis, heart failure, and the patient's age are essential. In neonates, cyanotic heart diseases are often due to transposition of the great vessels, while in older children, tetralogy of Fallot is more common. We also need to consider signs like cardiomegaly and altered pulmonary vascular markings. Right to left shunts often present with decreased pulmonary vascular markings and cyanosis, while left to right shunts can increase these markings due to increased pulmonary blood flow. In terms of left atrial enlargement, which we see here, it can manifest in several ways on a plain film. Splaying of the carina is a classical sign. In this case, the nasogastric tube displacement to the right is a helpful marker. You might also see a double density sign through the right upper heart border. Chronic mitral regurgitation and stenosis can cause these changes, leading to left ventricular enlargement due to increased diastolic volume. In cases of stenosis, the left ventricle isn't enlarged, and the aorta might be smaller. In summary, this case highlights the importance of a thorough evaluation of chest radiographs in infants, especially considering potential congenital heart diseases. The findings here suggest a complex cardiac condition that warrants further investigation with echocardiography and possible interventions. For those following along with Radiology Made Easy, I hope this case has been insightful and helps underscore the critical aspects of pediatric radiology and congenital heart disease. Remember, each image and finding is a piece of the puzzle in reaching a comprehensive diagnosis.